Every year, thousands of people overlook the earliest signs of a brain tumor, not because they are careless, but because these early warnings arrive quietly. A slight shift in vision, a headache that doesn't feel normal, a strange moment of confusion, a sudden lack of balance. These symptoms seem ordinary, easy to ignore, and easy to blame on stress, sleep, age, or lifestyle. But the truth is, brain tumors rarely begin with dramatic symptoms. They start with whispers, subtle disruptions in how your brain sends messages, controls movement, processes senses, and protects itself. Inside your skull, there is almost zero extra space. If even a few millimeters of abnormal tissue try to grow, the brain immediately begins to struggle for room. Pressure rises, nerves become compressed, blood flow changes, signals misfire, and that's when the earliest signs appear, slow, confusing, and often dismissed as nothing serious. Early recognition can make a life-changing difference. Medical research consistently shows that tumors detected early have a far greater chance of successful treatment, fewer surgical complications, and better long-term recovery. So today, we will break down 9 early signs of a brain tumor, explain deeply, clearly, and in a way that helps you truly understand what your brain might be trying to tell you. Now let's dive into these warning signs. 1. Headache changes. A headache alone does not mean a brain tumor, but a headache with a new or unusual pattern deserves attention. Tumor-related headaches often worsen in the morning because lying down during sleep increases pressure inside the skull. Some people describe it as a deep, heavy pressure, like something is pushing outward from within. It may worsen when coughing, sneezing, bending forward, or turning the head quickly, any movement that shifts pressure. Unlike stress headaches, these do not improve with rest or common painkillers. Nausea and vomiting may happen, even when the stomach feels normal, because the tumor can irritate the brain's vomiting center. If headaches gradually become more frequent, stronger, or different from anything you've had before, the brain may be signaling rising intracranial pressure. 2. Vision disturbances. Your eyes can be perfectly healthy, and still lose clarity, because seeing is a brain function. The optic nerves and visual cortex are extremely sensitive to pressure or interruption. Early vision problems may include blurred focus, double vision, flickering lights, reduced peripheral vision, brief blackout moments, or difficulty tracking moving objects. Sometimes colors look slightly dimmer or reading feels strangely harder. People often blame screens, late-night work, or a need for new glasses, but tumor-related changes often appear suddenly, and in one eye rather than both. If visual symptoms come and go repeatedly without an obvious trigger, especially with headaches, the brain's visual system may be under stress. 3. Personality shifts. Your personality is shaped largely by the frontal lobe, which acts like the control center for behavior, decision-making, motivation, and emotional balance. When a tumor disrupts this area, changes can appear long before physical symptoms do. A usually calm person may become irritated easily. Someone social may withdraw. A responsible individual may begin taking risky actions or making unusual decisions. Motivation to work, interact, or enjoy hobbies may fade unexpectedly. Friends and family often notice first and say something like, "You don't seem like yourself lately." Emotional instability, unexplained anger, anxiety, apathy, or depression could indicate that the brain's personality circuits are being affected, especially if these changes escalate without any major life event or mental health history. 4. One-sided weakness. The brain controls each side of the body in a crossed pattern, so tumors affecting the right brain can weaken the left side of the body, and vice versa. This may start as light tingling, clumsiness, or a feeling of heaviness in one arm or leg. You may trip more often, drag one foot slightly, or lose the grip on everyday objects. Progression is usually gradual, not sudden like a stroke, which makes it easy to dismiss at first. Temperature sensitivity may also change, or there may be numb patches on the face or body. Because motor pathways run through narrow spaces in the brain, even a small lesion pressing on them can interfere with movement and touch, signaling that something unseen is causing disruption. 5. Memory fog. Brain tumors can make it difficult for the brain to store, organize, and recall new information. Early problems usually involve short-term memory, forgetting recent conversations, repeating questions, misplacing items more frequently, or struggling to follow multi-step instructions. Concentration becomes harder, conversations feel harder to track, and thinking may feel slower than usual. The hippocampus and temporal lobes, areas critical for memory, are easily impacted by pressure changes. A person may still remember old memories perfectly, but struggle with everyday details. If this mental fog comes on quickly or keeps worsening, especially in younger people, who normally have strong memory, the brain may be signaling deeper neurological disturbance. 6. Balance trouble. The cerebellum, located at the back of the skull, controls balance, coordination, and smooth body movement. Tumors here can make basic physical tasks unexpectedly difficult, such as turning without stumbling, walking a straight line, or standing up without swaying. You might drop objects more often, misjudge distances, knock things over, or feel like the floor is tilted. Some people describe a sensation like being on a boat, unsteady and unpredictable. Unlike quick dizziness from dehydration or low blood sugar, tumor-related imbalance tends to persist and slowly worsen over time. If everyday coordination skills suddenly feel unreliable, the neurological control center for movement may be under pressure. 7. Hearing changes. The hearing process involves not only the ears, but also auditory nerves and temporal lobe processing centers in the brain. When a tumor affects these pathways, symptoms may include ringing or buzzing, tinnitus, muffled hearing, hearing loss on one side, or difficulty recognizing where sounds come from. In some cases, people hear a rhythmic pulsing sound, matching their heartbeat, a sign of abnormal blood flow near auditory structures. Because these symptoms are often blamed on earwax, sinus issues, or aging, diagnosis is easily delayed. If hearing changes persist without an ear-related cause, especially in just one ear, a deeper neurological evaluation is recommended. 8. Speech difficulty. Language is one of the brain's most complex functions. Tumors affecting Broca's or Wernicke's areas can make a person know what they want to say but struggle to form the words. Sentences become choppy, wrong words slip out, or simple vocabulary becomes difficult to recall. Some people pause mid-sentence, confused about the next word. Others mix up similar words accidentally. These episodes may start subtle, happening only occasionally, but increase in frequency over time. Because speech pathways depend on timing and rapid communication between brain regions, any pressure or damage can interrupt fluid expression long before other symptoms appear. 9. Mild seizures. Many people are shocked to learn that not all seizures are dramatic. A seizure simply means that a group of brain cells fired abnormally and all at once. Early seizures can look like short staring spells, repetitive lip or hand movements, a sudden rush of fear, unusual smells or tastes, small facial twitches, or intense déjà vu that feels too real to ignore. These moments may last only a few seconds, and the person may not even recognize them as seizures. But neurologists emphasize that any repeated episode, in which consciousness, sensation, or movement briefly glitches, should be medically tested, especially if combined with headaches or other neurological symptoms. These 9 signs together create a picture, a pattern, of how the brain reacts when something inside begins to grow where it doesn't belong. Many of these symptoms can come from harmless causes like stress, sinus problems, migraines, or age-related changes. But when these symptoms appear suddenly, persist for weeks, grow worse, or occur in combination, they should never be ignored. Early evaluation doesn't just help detect tumors sooner, it protects your brain's ability to think, feel, move, speak, and experience the world fully. Awareness is not fear. Awareness is power. And one medical checkup could truly make all the difference. If this guide helped you understand the early signs better, make sure to subscribe for more life-saving health insights, and I'll see you in the next video.